All right, so this is going to be the second video covering the axial skeleton for the Anatomy and Physiology 1 lab. The first video, we basically covered the bones and the markings of the skull. And so what we're going to do is we're going to complete the axial skeleton, talking about the hyoid bone, the vertebral column, which includes the sacrum and the coccyx, the ribs, and the sternum. All right, so we're going to finish this up. First bone we're going to talk about is called the hyoid bone. So what I want to do is I want to show you what the hyoid bone looks like. So this is what it looks like, all right? Now, one thing I want to point out about the hyoid bone is actually found just inferior to the mandible. And notice, this is the only bone in the skeleton that does not articulate or form joints with other bones. What I'm going to do is I'm going to show you right here. I've got the articulated skeleton right here. Obviously, it's missing the skull. But what I want to do is I want to bring it forward just a little bit because you can actually see the hyoid bone right here. So this is the hyoid bone right here. Now, notice again, they've got it attached to one of these cervical vertebrae. It doesn't attach to the cervical vertebra. It's actually quite separate, all right? So this is the only bone that does not articulate with any other bone in the body, all right? So when we look at the hyoid bone, all right, there's actually three markings that we can actually point out. Now, towards the medial aspect, this area right here, all right, this area right here, this is referred to as the body, all right, this is referred to as the body. And then coming off the body, all right, you're going to have two pairs of process. One's going to be a little bit smaller, and the other one's going to be a lot larger, all right. This one right here, let me use my blunt probe. This one right here, this is called the lesser horn, and then this whole thing right here is the greater horn, all right? And so again, a lot of muscles and tendons are actually going to be attached here. It's going to be right above the larynx, and this is going to be especially important in elevating the larynx when we swallow, all right? It's also involved minimally in speech, but again, one more time, body, lesser horn, and then greater horn. So this bone right here, this is the hyoid bone. Now, what we're going to be doing is we're going to be focusing a lot on the vertebrae. Vertebrae is actually plural. Vertebra is actually singular. In most normal individuals, all right, there's actually going to be 24 individual vertebrae, all right? So what I want to do is I want to show you this. I don't know if you can actually see it here. I guess I'll need to bring him a little bit closer, all right? You may not be able to see it, but just bear with me. The first 7 vertebrae, so 1, 2, 3, 4, 5, 6, 7, all right, are all referred to as cervical vertebrae. The word cervical actually refers to neck, all right? So again, the first 7 are the cervical vertebrae. We basically label these things. C1, which is superior most, C2, C3, C4, C5, C6, and C7. All right, so again, we basically number them from the most superior to the most inferior. Now, the next 12 are all referred to as thoracic vertebra. All right, so again, if you count these things again, counting 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. All right. All of these vertebrae actually have a pair of ribs attached to those, all right? And again, they're basically labeled. This first one is called T1. This last one is called T12, all right? So again, T1, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, and T12. So those are the thoracic vertebrae. These last 5, 1, 2, 3, 4, 5, they're referred to as lumbar vertebrae, all right? And again, they're basically labeled L1, L2, L3, L4, and L5, all right? And all of these vertebrae are basically separated from one another. They're actually connected by these intervertebral discs, which are basically these layers of fibrocartilage that basically rest upon each other because, again, we're bipedal, all right? And so, again, this basically provides that cushion, all right, that basically provides protection because, again, lots of stress on the vertebra, all right? So, first of all, before we actually start, all right, we're going to go over the general structure of a typical vertebra, all right, a typical vertebra. So what I've got is I've got this thing right here. So this is a typical vertebra, all right. Now later on, all right, in this video, we're actually going to have to be able to distinguish the difference between a cervical vertebra, a thoracic vertebra, and a lumbar vertebra. But this is just a typical vertebra. So the first thing we're going to look at is some of the markings on a typical vertebra. So the first thing we're going to do is talk about something referred to as the vertebral canal. Vertebral canal is usually a hole that's usually large or deep, and it's this thing right here. This right here, this is the vertebral canal, all right? I can actually stick the red pipe cleaner through it. Whoops, hold on. This right here, vertebral canal. And in most of the vertebra, the spinal cord's actually going to be sitting here. But notice that once you go beyond L1, all right, there's nothing but spinal nerves there, all right, because actually the spinal cord will actually end at L1, or the first lumbar vertebra. So again, vertebral canal. Now this next one is called the body, but some books call it the centrum. So again, if you actually look, this entire thing right here, this is the body or the centrum, all right? This is the body or the centrum. Next thing is the spinous process, all right? And here, there's only going to be one spinous process, and it's this thing right here. So this right here, this is the spinous process, all right? This is the spinous process. Now, when we talk about transverse processes, there actually is going to be two transverse processes, all right? So there's going to be one transverse process over here, and there's going to be another transverse process over here. So again, these things right here, these are the transverse processes, all right? Now, what's going to connect the transverse process to the vertebral body, all right? Well, they're basically markings referred to as the pedicels. And so again, if you go over here, all right, making sure, so body or centrum, spinous process, this is the transverse process, and then this area right here, that's basically going to connect the transverse process to the body or centrum. This is referred to as the pedicel. All right, so you're going to have a pedicel on one side, and you're going to have a pedicel on the other side. All right, so these are the pedicels. Now, what's going to connect the transverse process to the spinous process? This is something referred to as the lamina, all right? And again, you're going to have the transverse process, the spinous process, and that connection point in between is going to be called the lamina, all right? So there's going to be a lamina on one side and a lamina on the other, all right? So again, lamina, lamina. It's kind of hard to see, on at least point out on this vertebra. Next thing we're going to look at is something referred to as the superior articular process and the inferior articular process, all right? Obviously, superior means towards the head. Inferior means towards the feet or away from the head, all right? So if you look over here, what we're going to do is we're going to tilt the vertebra laterally. This entire thing right here, this is the superior articular process. I do want to make a point. There's a little flattened area right here. A little flattened area right here. This is called the superior articular facet. This is actually where the vertebra on top of this will actually articulate to basically form a joint. All right, so again, superior articular process, and then this flattened area right here is the superior articular facet. The other one is the inferior articular process. And so if you look over here, it's kind of hard to see. It's this area right here. I'm using my blunt probe. This is the inferior articular process, and again, there's going to be a little flattened area right here, all right? So this is the inferior articular facet. For us, all right, we're just going to call the whole thing the inferior articular process and the superior articular process. Next, we have something referred to as the inferior notch, all right? And it's this thing right here. Using my blunt probe, this is the inferior notch. This is actually going to help to form something referred to as the intervertebral foramen. These are actually where spinal nerves, all right, are basically acts as a passageway for these spinal nerves. And so again, inferior notch is this thing right here, all right? Now, the next thing we're going to do, all right, is we need to distinguish the difference between a cervical vertebra, a thoracic vertebra and a lumbar vertebra, all right? So what I'm going to do is show you a couple of unique things on this. If you look at this vertebra right here, you can basically see it's got basically almost the same structure, all right? But notice it has something that other vertebra or other types of vertebra will basically lack. And it's these things right here. These are known as the transverse foramina. Remember, foramina is plural, foramen is singular. These basically act as passageways for the vertebral arteries. You're only going to find this in cervical vertebra. So all cervical vertebra, all 7 of them, will have these transverse foramina. If you look at a thoracic vertebra or you look at a lumbar vertebra, notice what it lacks. It doesn't have the transverse foramina, all right? So if it has the transverse foramina, you automatically know, hey, that's a cervical vertebra, all right? Now, one other thing I want to point out is you may have to distinguish the first cervical vertebra and the second cervical vertebra, all right? So how can we actually distinguish these, all right? Well, the first cervical vertebra, which is sometimes called the atlas, all right? If you look over here, this is what it looks like. Obviously, you know it's a cervical vertebra because it basically has the transverse foramina right here. But note, one thing that the first cervical vertebra or the atlas doesn't have that every other vertebra has is a body. Look at that. There's no body or centrum to this, all right? So again, this is the first cervical vertebra. You may call it that on the lab test, or you can call it the atlas, all right? So this is the atlas. And the other one is C2. This is the second cervical vertebra, all right? And notice again, if you actually look at this, say, hey, look at this. How do I know it's a cervical vertebra? Look at this. Transverse foramen. So look at that. So it automatically knows the transverse foramen, but it actually has a marking that no other vertebra has. It's this thing that's coming up right here. It's basically going superior towards the head. This is called by 2 different names. It's called the dens, or sometimes it's called the odontoid process. I do like the odontoid process a little bit better, and the reason why, because it's got that word odon, which means tooth, and it literally looks like there's like a little bitty tooth that's actually attached to the body or centrum of this one. So you can call this the second cervical vertebra, or it has another name. This is called the axis, all right? So the first cervical vertebra is called the atlas, and the second cervical vertebra is called the axis. And note again, this for the axis or the second cervical vertebra, it has the dens or odontoid process. For the first cervical vertebra or atlas, it basically lacks a cell body, a body or a centrum, all right? It lacks a body or a centrum. So keep that in mind. Now, the next vertebra we're actually going to look at is something referred to as the thoracic vertebra, all right? So there's a couple of ways we can do this. Now, because we're looking at plastic models, all transverse vertebra, all right, will actually have these little facets and demi-facets attached to those, all right? And actually, if you look at a real vertebra, as far as the thoracic vertebra, you can actually see these, all right? But because we're looking at plastic models, all right, it's going to be hard to see these on the plastic models. But there's some other little features that we can actually look at that. So the first of all is look at the vertebral canal, all right? Typically, for a thoracic vertebra, it's going to be completely circular. It's going to be completely circular, all right? When you look at a lumbar vertebra, look at that. This is a lumbar vertebra. This is the vertebral canal, but notice it's not circular, it's triangular. So again, for a thoracic vertebra, circular vertebral canal. For a lumbar vertebra, it's going to be a triangular vertebral canal. And the other thing that we can actually look at are these things right here. They're the spinous processes, right? So this is the spinous process of the thoracic vertebra. This is the spinous process of a lumbar vertebra, all right? Typically, for a thoracic vertebra, it's going to be pointing down and it's more angular. All right, it's more angular. Usually for a lumbar, it's going to be pointing straight back and it's more square shaped. All right, it's more square shaped. And so again, that's going to be the best way to distinguish the difference between a cervical vertebra, a thoracic vertebra, and a lumbar vertebra. All right. So again, make sure you know the different types of vertebra: cervical, thoracic, or lumbar. Now, to complete the vertebral column, all right, we need to talk about two more bones. Two more bones. One's referred to as the sacrum, and the other one's referred to as the coccyx. I do want to make a point that during embryological development, all right, you're actually born with 5 sacral vertebrae. But what happens is these sacral vertebrae will fuse together to form one bone, all right? And we can actually see this. And so again, this is basically the model that I'm basically going to show you. This is the plastic model, all right? This right here, this is the sacrum, all right? This is the sacrum. And you can actually see S1, S stands for sacral, so S1, S2, S3, S4, S5. So they all fuse to form the sacrum. Now, unfortunately, the plastic models that we often have an extra bone attached to them. It's this thing right here. This is called the coccyx. This is actually a separate bone, and normally, again, it's very typical. It's very similar to the sacrum. So what's going to happen is basically it results from the fusion of 4 coccygeal vertebrae. So again, CO1, CO2, CO3, and the little one right there is CO4. So they basically fuse to form the coccyx. That's kind of like our tailbone, all right? Although humans, at least when we're born, don't express tails. I do want to make a point. Occasionally, this fails to tuck in, and so when a newborn baby is born, they may have a little nub that kind of looks like a tail. And as a doctor, you don't say, hey, your child was born with a tail, because people who are of non-scientific or don't know anything about science, they freak out. But we all have tailbones, at least embryologically, all right? But normally, most people don't have this, or it's basically inside. So again, when we're born, typically humans don't have a tail, all right? But again, this is the coccyx. So we have the sacrum and we have the coccyx. Now for the coccyx, all right, we're not going to worry about any markings, all right? We're not going to worry about any markings. But for the sacrum, we have to look at a couple of markings, all right? Because they're going to be big, that hopefully may play a role a little bit later on in your career. So the first thing we're going to look at is something referred to as the superior articular process. And notice, we already talked about the superior articular processes of the vertebra. It's going to be very similar. So if you look over here, this right here, this thing right here, and this thing over here. These are the superior articular processes. And again, we're going to have the superior articular facet. A facet is basically a flattened area right here that's going to articulate with L5, or lumbar vertebra 5. All right? Next is something referred to as the anterior sacral foramen. Notice again, another word for anterior is ventral. So it depends on the textbook you're looking at. So we can call it the anterior sacral foramen, or we can call it the ventral sacral foramen. Now, the next marking underneath it is called the posterior sacral foramen. And remember, another word for posterior, at least in humans, is called dorsal. So we can call it the posterior sacral foramen or the dorsal sacral foramen. Now, unfortunately, if I take my red pipe cleaner and I stick it through here, and normally what I do, at least on the lab test, is I do it like this. And I do allow you to pick up the bones during the lab test, all right? Whoop, come on. Make sure you go there. So if I'm looking at this, this is the anterior or ventral side. This one over here is the posterior or dorsal side, all right? So if I'm actually looking at this, all right, I'm looking at this, hey, wait a minute, this is the dorsal or posterior sacral foramen, all right? Now, if I put this down and another student picks it up and they pick it up and I turn it around, hey, wait a minute, this is the anterior or ventral sacral foramen, all right? Usually on the test, the best way is just basically don't use the adjectives. In other words, I'm not worried about ventral or dorsal or anterior or posterior. Just write sacral foramen. Look at this. Sacral foramen, sacral foramen, sacral foramen. Look at over here. Sacral foramen, sacral foramen, sacral foramen. So again, we're just going to call these sacral foramen. These are basically the passageways for different types of spinal nerves. All right. Next, we have something referred to as the median sacral crest. And again, it's going to be kind of hard to see this on the plastic models. All right. Usually the median sacral crest is basically where the spinous processes of the sacral vertebra will actually fuse to form a prominent ridge of bone. All right. On this plastic model, of course, this is the dorsal or posterior side. It's kind of hard to tell because it doesn't really form a crest. All right. But notice, this is actually a real sacrum, all right? And we can actually see that we basically have a nice prominent ridge of bone. So this is the median sacral crest, and we do have a plastic model, all right? I'm not sure where it came from. I think it was hidden from me for many years, over 11 years. But look at this. This right here, we can actually see it. This is a nice prominent ridge of bone. So again, medial sacral crest. And then finally, we have these little wings that come off, all right? These little wings that come off, this is referred to as the ala, all right? This is referred to as the ala. And note that these surfaces, these lateral surfaces of the ala, are basically going to fuse with the hip bones, or sometimes referred to as the os coxae, to basically form the sacroiliac joint, all right? So again, this is the sacrum, and what's nice about this is just the sacrum. It's actually missing the coccyx over here, which is interesting. But most of the plastic models that we have, this bone right here is the sacrum. This bone right here is referred to as the coccyx. All right? Now, next thing we're going to do is we're going to talk about the ribs. All right? So what I'm going to do is I'm going to pull my articulated skeleton a little bit closer, all right? And I may have to adjust my my camera, my webcam on this one, all right? So let's look at this. Humans actually have 12 pairs of ribs, all right? 12 pairs of ribs. And notice if you actually look in your textbooks, we're not really worried about the markings on a lot of these ribs, all right? But what we're worried about is the types, all right? Because again, we can basically divide the ribs into 2 or 3 types. For us, we're actually going to be dividing them into 3 separate types. Now, one thing I want to point out is that when you look, a lot of books will basically divide the ribs into true ribs and false ribs or fake ribs, all right? We're not going to do that because, again, these are common names, and we're going to be just a little bit more scientific. So first of all, if you look, there's going to be 3 types of ribs. The first 7, and in fact, we basically go it from the superior to inferior. The first 7, ribs 1, 2, 3, 4, 5, 6, and 7, are all referred to as vertebrosternal. If you actually look, this is actually rib 1. It's kind of hard to see because of the clavicle. Here's rib 1, 2, 3, 4, 5, 6, and 7. And the reason why I basically call these vertebrosternal is because they have their own cartilage called the costal cartilage, which actually unites the rib to the sternum, all right? These are often considered to be the true ribs, but I do want to make a point. If you put true rib on your laboratory practical, it's going to be wrong. These are called vertebrosternal, all right? So that's ribs 1 through 7. Now, ribs 8, 9, and 10 are referred to as vertebrochondral or vertebrocostal. Note, here's rib 8, rib 9, rib 10. And notice they still have their costal cartilages, but notice their costal cartilages will actually unite with this costal cartilage, which is rib 7, all right? So again, sometimes we consider these to be false ribs, all right? But again, when I basically give you rib 8, 9, and 10, if you put false rib, guess what? It's wrong, all right? We're going to call these either vertebrochondral or vertebrocostal. Chondral means cartilage, and costal means rib, all right? And then the last 2, And we can actually see I'm gonna turn the articulated skeleton around here, rib 11 and rib 12, all right? These are sometimes referred to as floating ribs, but again, if you put floating ribs on your laboratory practical, it's wrong, all right? We're gonna call these vertebral ribs, and the reason why we call them vertebral ribs is because it's only uniting with the thoracic vertebra. It's not even uniting, all right, with the sternum. And basically, they lack the costal cartilages, all right? So again, ribs 1 through 7, vertebral sternal. Ribs 8, 9, and 10 are vertebral chondral or vertebral costal. And then ribs 11 and 12 are the vertebral ribs, all right? So we've got one more bone to finish us up for the axial skeleton, and it's this bone right here. This is sometimes referred to as the breastbone, but again, we don't use common names. This bone right here is called the sternum, all right? So what I'm going to do is I'm going to pull my articulated skeleton back, and we do have this thing right here. So I do like this, all right? And so again, we can basically see the costal cartilages here on the side, but this entire thing right here, all right, is called the sternum, all right? So first of all, let's look at some markings, all right? Now, usually, all the bones don't fuse embryologically until about the year 30. Thinking like, oh my God, so if you're younger than 30 years old, you may still have some bones that are actually separated. But once all these bones, there's actually 3 separate bones. There's the first bone right here, the second bone right here, and then this thing right here. Once they all fuse together, we call this the sternum, all right? So what we're going to do is look at the markings. And so we're going to assume that when I show you this, all right, that the person that's basically it's derived from is 30 years old or older, all right? So again, first of all, manubrium. Let me have my blunt probe right here. So this thing right here, this is the manubrium, all right? Now, there's going to be kind of an immovable joint right here between the manubrium and then this large segment of the sternum right here, which is called the body. This is called the sternal angle, all right? So again, manubrium, this right here is the sternal angle. This large portion of the sternum is called the body. Now, this little extension coming down is called the xiphoid process, all right? And the reason why is this is probably going to be the last thing that basically fuses with the sternum, and normally that happens between the years of 25 and 30. So again, this is the xiphoid process. But again, that little line, all right, that basically joins the xiphoid process with the body of the sternum, this is called the xiphosternal joint. So let's go over this one more time. And again, the name of the bone is the sternum. And what we're going to do is move from superior to inferior. So hold on. Sternum, that's the name of the bone. This thing right here is the manubrium. This thing right here is called the sternal angle. This thing right here is called the body. This thing right here, this little line, is called the xiphosternal joint. And then this thing right here is called the xiphoid process. All right? So we're actually done with the axial skeleton. All right? If there's any questions, I'll answer them in lab. If not, good luck on your first laboratory practical.